Thanks for coming to this afternoon's press conference. In the past week, the number of new cases in the community has remained low, at an average of 9 per day in the past week compared to 12 cases per day in the week before. The number of unlinked cases in the community has also remained low at just a handful. While we have seen an increase in the number of imported cases, most are returning Singaporeans and permanent residents, as well as work pass and long-term pass holders who are employed here. All of them have been isolated or placed on a 14-day stay-home notice upon arrival in Singapore. The risk of transmission to the community is therefore very low. Many of them are asymptomatic, but we had tested them while they were serving their SHN and managed to detect them. In recent weeks, there has been an increase in the number of COVID-19 cases in migrant worker dormitories, mainly because we are now clearing the last few purpose-built dormitories with relatively high prevalence rates. My co-chair, Minister Lawrence Wong, will provide an update shortly. We will need to continue to pay particular attention to the cases in the community. On the whole, the number of community cases remains low. The number of community-linked cases has remained at about 4 per day in the past week. On the unlinked cases, we are seeing about 5 cases per day in the past week, and most of these were detected as part of our proactive testing of those in essential services, including the construction and related sector. Most of these workers are serology positive, meaning their infections are not recent ones, but previous ones. The prevalence of unlinked cases picked up from those who presented with acute respiratory infection, or ARI, has remained low at about 3 cases in the past week, and that is 3 cases in a week, not 3 cases per day. This is in spite of the expanded community testing criteria from 1st July to test all individuals aged 13 and above who are diagnosed with ARI at first presentation to a doctor. We are now on a good footing, but this can easily change if there is a big cluster and which may spawn second or third generations of infection. And this is why Ministry of Health has been actively identifying high-risk settings to aggressively test and contact trace cases. Coupled with surveillance, this will give us an early sense of emerging cases. When we detect cases, we have taken steps to draw large rings around them to isolate contacts quickly and prevent further transmission. Over the past months, we have conducted several swab operations associated with new emerging workplace clusters. Beyond the workplaces, we also launched swab operations to test individuals who work at retail businesses frequented by multiple positive cases, including 2 supermarkets, and none has tested positive. But no matter how much we do in terms of screening and surveillance, the role of the individual is critical in our fight against COVID-19. Safe distancing measures, good personal hygiene, and mask wearing remain the mainstay of our fight against the virus, so that we can continue to keep transmissions low. From an analysis of the activity patterns of the community cases, we found that about 40% of these community cases had continued to engage in activities after symptoms onset and before they were isolated. Of these, about a third went to work, and many also visited shopping centres, supermarkets, and hawker centres. Such behaviour jeopardizes our collective efforts to fight COVID-19 and could lead to infections of loved ones, friends, and colleagues. We urge everyone to see a doctor early if you feel unwell, and to stay at home throughout the duration of your medical leave or before your swab results come back. We have also stepped up efforts to remind the public to observe safe distancing and to enhance crowd control measures at hotspots. But we cannot and should not rely on enforcement to remind ourselves to be socially responsible. In this new COVID normal that we need to move to, the role of individual is crucial. Fighting the virus requires significant shifts in behavior and mindset. Some of these changes may be inconvenient or even painful, but we can change our social norms if we make a collective effort by each playing our part. Now I'll ask Director of Medical Services, Professor Kenneth Mak, to give a quick update on today's medical situation.
Thank you very much, Minister. As of the 24th of July noon today, the Ministry of Health has provisionally confirmed an additional 277 cases of COVID-19 infection. More details will come out in the press release that will be issued later tonight. Provisionally, based on the media release that we have issued this afternoon, there are 5 cases in the community, of whom 2 are Singaporeans or permanent residents, 3 are work pass holders. We also have 2 imported cases who were diagnosed while being placed on stay-home notice after their arrival in Singapore. And the vast majority of cases still remain work permit holders who are residing in foreign worker dormitories. The rest of details and more clarification on these details will be provided in the media release later tonight.
Good evening. It has been a challenging and tough journey for everyone involved in clearing the migrant workers and the dormitories. And I want to start by thanking all our frontliners who are involved in this very extensive operations. They have worked very hard, and we are finally reaching the last stretch. By the first week of August, say around 7th August, we expect to clear all our dormitories, with the exception of a few blocks within the dormitories that are still serving as quarantine facilities. These are 17 standalone blocks in the purpose-built dormitories which will serve as quarantine facilities. Other than that, we expect to clear all the dormitories by the end of the first week of August. This also means that the vast majority of migrant workers will also be cleared by that time. By the end of that first week of August, we expect that there will be some workers who will be completing their isolation periods. We are looking at a last batch of about 28,000 workers. They would have completed their isolation periods toward the end of the first week of August. We will do a final COVID test for them, and we hope many of them will be negative, and so they can resume work. Some of them may still test positive even after that, and as those of you who have been with us on this journey know that we do not just stop at that one test, because if they test positive, then you have to repeat the isolation cycle. So there may be some who have to repeat the quarantine because they test positive, but that would be the minority. Essentially, by the 7th of August, we expect to clear all dormitories and the vast majority of migrant workers. And thereafter, we will be working very closely with all the companies who are engaging these workers to allow them to start work and to allow work to resume as soon as possible. So we would expect companies to be getting ready even now for their workers to be cleared, so that come, by August, when the vast majority of workers are cleared, the companies themselves will also be ready with all their safe management practices at the work sites and will be able to resume work as soon as possible. That's on the dormitory front. In terms of the community, we also need to continue to keep watch and stay very disciplined, as you heard just now. We want to remind everyone to uphold socially responsible behaviors, going to see a doctor if you are sick, but also remembering to uphold all the safe distancing measures that we have highlighted. We have observed some areas where there have been more people gathering in recent time, particularly in the beaches and the parks over the recent weekends. Last weekend in particular, perhaps because that was the start of the school holidays, so we saw more people gathering there. And that's why we are stepping up our checks, we are stepping up our enforcements, and we are also putting in place enhanced control measures at these popular places. For example, monitoring the people who are entering the beaches or the parks, and where it comes close to capacity limits, we will proactively stop people from going in, and we will also close the car parks that are serving these popular areas. So these actions are being taken at some of these public spaces. We are also continuing to watch very closely the popular night spots where people gather for dining. Name the night spots that you frequent, whether it's Holland Village, whether it's Dempsey, whether it's Robertson Quay, whether it's Circular Road. Our officers, safe distancing ambassadors are deployed, and enforcement officers are deployed regularly to monitor and to take enforcement action where necessary. So over the last week, we had to issue suspension notices and fines against 2 F&B establishments along Circular Road. That's Try Again and Los Amigos. They are closed for dining in, and their establishments were also issued with fines because of breaches of safe distancing measures, and because they had groups of more than 5 people gathering there, and this was done even after warnings were issued to these establishments. So that's the approach, as we have said, we will take. Again, we call on all business operators, all F&B operators to do their part and take the safe distancing measures seriously, because our safe distancing ambassadors, our enforcement officers are on the ground, and if they were to pick up any breaches, then swift enforcement action will have to be taken to ensure the safety of all their customers and all Singaporeans. And that's why it's in the interest of business owners and operators to really take these measures seriously. Finally, if we look at the overall situation, with the dormitories being cleared, the workers being cleared by the first week of July, largely, with the community situation under control, we can expect our overall cases, the daily cases that we report every day, to come down by around the middle of August. You won't see these large numbers anymore because we would have largely completed the clearing of the dormitories. But I must again remind everyone, just because the case count comes down, that shouldn't be a reason for us to go out to celebrate and to, have a big party. Again, remember, this fight is not over. It's still a long way there's still a long way to go. On the community front, we have to be vigilant. We need everyone to cooperate, be disciplined, and as I said, we will monitor the situation on the ground, and enforcement actions will be taken swiftly where necessary. Even for the dorm cases, while we may have cleared all the workers and the dormitories by August, we will, as I highlighted before, continue to put the workers on regular and routine testing. As they go back to work, we continue to monitor them very closely at their work sites and in the dormitories, and we subject them to routine and regular testing. And we do expect from time to time, cases may emerge. As you already see today from the migrant workers who are in the community, that you see a few cases emerging every day in the teens or sometimes in single digits, but these cases do emerge, and we certainly must expect such cases to emerge from the migrant workers in the dormitories, even after having gone through a very comprehensive and rigorous clearance process. They may be older infections, and that's okay, but sometimes it may be a new infection, and that's the one that we are very concerned about. So we will still pay very close attention to this whole area, the migrant workers who are in the dormitories, as well as the construction and construction-related sectors for which we have identified to be of higher risk. And if we detect and through our regular testing, identify any positive case, we will have to go in quickly, again, do our usual operations, ring fence the area, stop work even, and then do a sweep and aggressive testing around all the close contacts. So for the contractors who are very keen and I'm sure eagerly waiting to resume work, and they can do so very soon, I would also remind all of them to take the safe management practices very seriously. Make sure that they put all these measures in place as they prepare to resume work. Because if there is a new infection found amongst their workers, they may very well have to be prepared for the entire work process to stop for a while we do all the testing and sweeping up of the close contacts that's necessary in order to prevent large clusters from forming. So again, this is something we constantly remind everyone, but it's important that all of us take these measures seriously so that we can keep COVID-19 at bay while we progressively reopen our economy and society. Thank you.
We're now open for questions from the media.
Dear media, we have now started the Q&A session. A reminder that the contents of the press briefing are to be embargoed until the time that I will announce later. Please raise your blue hand should you wish to ask questions. Okay, we'll have the first question from Lim Yen Liang from Straits Times.
Hi, can you hear me?
Yes.
I would like to ask the panel, what is the timeline like for once the dorms are cleared for the workers to be moved to the temporary facilities, the 60,000 beds that were announced earlier, whether these are the quick-built dormitories or the vacant state sites that are being planned? And are those 60,000 spaces to be filled progressively from August, and what the timeline is like to fill those spaces being prepared? Thank you.
So the work will continue. I don't have a specific timeline with me now, but the quick-built dorms are progressively being built, and as and when they are ready, we will start the process of reconfiguring the housing arrangements for the migrant workers from their present dormitories to some of these quick-built dormitories, and later on, when the new permanent dormitories which are being built are ready, that also will have another adjustment process. So it will be a continuing basis. It's not going to stop after August. August is when we clear all the dormitories and workers in the existing dormitories. But beyond that, that whole process of making sure that the workers are put in different housing arrangements through our quick-built dorms and our new permanent dormitories, that is an ongoing process which we will continue to do beyond August. The key to all this, as I said, is that the contractors must also take all the measures seriously. Just because the workers are cleared doesn't mean that they can just resume work in the similar fashion as they did before. So we do expect we will be working with all the contractors and subcontractors to make sure that as the workers are cleared, and just as they even right now get ready to resume work, the contractors must start to work out the housing arrangements. Some could be living in private estates or renting in the community. Some could be looking for the quick-built dormitories to be ready. Some could be in existing dormitories. So there will be some reconfiguration, and we are working with all the contractors to make that happen.
Thank you, Minister. We'll have the next question from Wyman from Zaobao. Wyman, please.
Hi, good evening to all. This is Wyman from Zaobao here. In the case of the Toguan dormitory, where a worker was informed only 3 weeks after being tested positive, I'd like to ask what was the rationale for using pool testing in that case? And given that we've previously only seen pool testing being applied to groups like low-risk groups like preschool teachers, is this strategy being applied right now to clear the dormitory cases? And will MOH follow up with individual testing if pool test results, for example, a dormitory room is positive?
Thank you very much for the question. You actually asked about pool testing and its role to play in two different settings, one in the dormitory setting and the second for routine regular testing. Pool testing is a strategy that allows us to perform PCR testing with a greater amount of efficiency in certain settings compared to doing individual testing, which obviously would consume a lot more test resources as opposed to pool testing. We do this in one of two different settings. In routine regular testing in a community where the incidence and prevalence of infection at this time is relatively low, we do this by bringing various people in the at-risk group that we are interested in. We subject them to pool tests, and if a pool test yields a positive result, we will recall all the people that were part of the group that was subject to that particular pool test sample, and they will all be then individually tested for us to determine who among them, in fact, contributed to a positive result. And once a positive individual test result is obtained, we would then treat that on its merits, and we would quickly isolate them as per what we would do for diagnosed case of COVID-19 infection. In the dorm clearance setting, pool testing is one of several steps as part of dorm clearance strategy. Often, a preliminary screening is done of the various dorms, and sometimes this would involve serology testing to get a sense of whether the prevalence rates of COVID-19 infection are high or low in that particular dorm, and where we think that we can then continue on with testing to clear the dormitories. Then we cohort some of these workers based on their accommodation, their living arrangements. We do a preliminary pool test, and on the basis of the pool test, then make a decision whether or not then to continue and proceed on with individual PCR testing. So individual PCR testing often is still done, and this is why Minister had recently explained that this week we were anticipating seeing higher numbers of cases being reported in our press releases coming out from dorm clearance, because this was a time when, after these various strategies, including pool testing, we were now subjecting those with previous positive pool tests to those individual tests to assess the individual workers' status for COVID-19. And if they subsequently have negative tests and they've undergone the required period of isolation, we are then confident to clear those workers as part of this dorm clearance strategy. However, if the individual tests turn out positive, then we know that they are still those individual workers are still infected, and they are subject to a longer period of isolation. This continues, as the Minister has mentioned, and because we are now reaching gaining momentum in this final stage for dorm clearance for testing, the high numbers of recorded and reported in the media will likely continue for the next week or so. And in fact, the numbers may in fact also increase compared to what it was over the last few days. And this is just because we are now testing a lot more aggressively in the remaining dormitories with a view towards clearing the remaining workers that are there.
Thank you for your question. Next question is from Jalila from CNA Digital. Jalila, please.
Thank you. So I want to ask for vaccines. Progress is a very big thing towards developing effective vaccines, and some countries have placed orders already. So
sorry, Jalila. Sorry, pardon if I may pause you there. You have frozen for a little bit. Could you please repeat your question? Thank you.
Okay, sorry. Can you hear me clearly?
Yes, this is good. Thanks.
Yeah, I suggest you speak slowly because it's intermittent, so we may miss a few in between.
Okay. So I am asking about vaccines. Progress has apparently been made towards developing an effective vaccine, and some countries are placing orders already. So I'm just asking whether Singapore has started doing that, and companies
Pardon, Jalila, we can come back to you later because unfortunately you have broken up again. But-
Maybe I can try. I think you asked about vaccines and what's the status of vaccine and whether Singapore is participating in any of these vaccine research and vaccine procurement. That's your question, am I correct? Yeah. Okay, I think Singapore, we have a few initiatives. I think I'll ask DMS to elaborate on from the scientific angle. There are some research work that's ongoing, collaboration between us as well as overseas partners in developing some of these potential candidates. And there are quite a lot of work going on, not just in Singapore, in various countries, and we are participating in quite a number of them. And in terms of securing supply of vaccines, we announced earlier that Singapore is participating in the COVAX facility, and DMS can also elaborate further on our participation. But some of these transactions and our strategy is strategic in nature, and there's also some business confidentiality involved, so we may not be able to share with you all the details, but I think suffice to say that Singapore is working quite proactively in discussing with the various vaccine developers, pharmaceutical companies, research institutions on both collaboration on research efforts as well as advanced procurement to ensure that we are able to have access to early access to vaccines that will become available in time to come. And I think it's not going to happen anytime soon. Vaccines probably, I think the earliest maybe end of this year, or which is I think it may be quite unlikely. It's more likely to be sometime next year, maybe even the middle or second half of next year. So we'll ask DMS to elaborate further.
Thank you very much, Minister, and thank you for your question as well. Indeed, we are extremely interested in working with various pharmaceutical companies and also on the international front, collaborating with a view towards being able to gain access to promising vaccine candidates. Once proven that these vaccines are efficacious and safe, it is our intent to bring as many of these vaccine doses into Singapore such that it can benefit our population. We are not banking on any particular individual vaccine candidate, but we have attempted to diversify our approach. That includes promoting and encouraging research to be done to identify promising vaccine candidates, bring them through the required phase 1, 2, and 3 trials, and eventually deliver a promising vaccine into the market. We have researchers in Singapore who are active in this particular area and are working to produce a locally produced vaccine even in Singapore. There are other pharmaceutical companies that may be keen on producing their vaccines in different areas in order to improve access globally of their vaccine to different countries. We hope that some of them may find Singapore attractive enough to consider Singapore as a production base for some of these vaccines. Certainly on an international front, we are collaborating with various companies as well as on the international front at WHO. Minister has mentioned the COVAX facility. We have registered our interest to participate in this COVAX facility. Currently, many discussions are in place right now, working through those operational details, and many of the discussions remain at quite an early stage, and it's premature to make definitive announcements at this stage about whether or not a particular vaccine would be de-vaccinated, that would be used, which would be procured, how it would be allocated, how it would be distributed. Those are details that's premature at this stage because these discussions are still continuing. In regard to a timeline, there are some of the companies who appear to be leading the pack, so to say, by making announcements that they've started phase 3 trials in various places around the world. But we do know that even if they are in this relatively later stage of the journey towards researching for promising vaccine, there may sometimes be successes, but there may still be failures in terms of delivering a safe and effective vaccine. And therefore, we remain watchful while some of the studies have started this year, practically speaking, we expect perhaps realistically a vaccine to be available perhaps next year rather than this year. And given the global demand for these vaccines, it may not even be in the beginning of next year, but perhaps towards the end of next year, where we might see vaccines produced in sufficient doses and available then for procurement and to be delivered into Singapore. So we continue to work on this space. We hope to get a vaccine for Singaporeans to benefit from as soon as is possible. At this stage, we don't know which of the vaccine candidates will be the one most likely to be delivered and brought into Singapore. But we continue to work at making sure we have access to those vaccines, and we will continue to work on in this space.
Thank you, Minister and DMS. Let's have the next question from Ardana from Reuters. Ardana, please.
Thank you. I just wanted to check if I could get an update on the Trace Together app, how many downloads so far, and also I wondered how many of the Trace Together dongles have been distributed. And ministers, I wondered if you are able to share some sort of example or color as to how Trace Together has aided in contact tracing in some of the cases.
I don't have the latest numbers with me, but our overall strategy remains the same, which is to not just rely on technology alone. It is an important enabler, but as we have highlighted before, we are building up our overall capability for swift and effective contact tracing. And that includes the human skills of the contact tracer. It includes the teams that are out to very quickly identify all the suspect cases and get them to and issue an electronic quarantine order to them as soon as possible. So with Trace Together, with safe entry, and with the capabilities of our contact tracer, we are now able to issue an electronic quarantine order to the suspect cases within a day of notification. And that has already sped up, accelerated our processes quite quickly. We are not stopping at this level. We are continuing to improve, and therefore, you know that we have been looking at wearables, the Trace Together token. We have done the first round of distribution, and we will, as we have said, continue to monitor that outcome and then see whether when new deliveries come in for more tokens, we will look at which other segments of the society we will distribute the tokens to in order for more comprehensive and more effective contact tracing. So this is a continuous work in progress, and we will give you further updates as and when they are available.
Yes, we don't have the figures here. I have been told that the uptake in usage, in downloads first of all, and then activating the app continues to increase steadily week on week. We have also started using Trace Together data as part of our contact tracing efforts, but it's important to mention that the Trace Together data resides on the phone of patients and cases. We do require to ask these patients for their permission before that data can be used, and it requires the patient to take that first step of uploading the data from their phone to our server so that we can then access the data. We cannot access the data on either on the Trace Together app without the permission of patients and cases. So that limits us because our ability to use Trace Together data is in fact heavily dependent on whether or not patients want to download the app, use the app, and then subsequently whether they give us permission to use it. We don't use the Trace Together data in a very prescriptive way, but often if it's used, it's often used as a memory aid. We go through still the fine art of talking to a patient, mapping his activities, then trying to contact trace, and we use the data from Trace Together to prompt our patients to remember details rather than necessarily using the data on its own. So for example, if the Trace Together data suggests that a person might have been in a particular location, then we might use that to just prompt the person's memory, because sometimes patients may not remember all these details. These may be encounters that occurred several days ago, but they've had many different encounters and they may not remember all the details. So we use it more as an aid, not necessarily as the main tool for the purposes of contact tracing. And even then, when it's used, it's always used with the permission of the patient.
Thank you, Minister and DMS. The next question is from Ang Po Ling from Channel 8 TV News. Po Ling, please.
Hi, Minister. Okay, earlier on you mentioned that from the middle of August, you can expect that the daily cases will come down. So I was wondering, I mean, previously you mentioned that entering into phase 3 would take a few months. So do we have a clearer idea like when we can expect to enter phase 3, and also with the wearing of masks, when can Singaporeans actually don't need to wear a mask?
We've always said that these measures that we are talking about in phase 2 are not contingent on just a single number. It's not about the daily cases that we see, and even if the cases comes down, I think there is still a need, as I highlighted earlier, to be very vigilant, because as we know from the nature of transmission and from COVID-19, it is highly infectious, and you are infectious even before you are symptomatic. So just because there are a few cases in the community doesn't mean now we can let our guard down, take away the mask requirement, and happily go out in groups, because just one case can easily lead to large clusters. We know this from our own experience. We also have the experience from many other countries to know that the virus can easily flare up again. So we expect all the safe distancing measures for wearing of masks, for upholding good personal hygiene, for keeping a physical distance away from one another unless you are in a group of 5. All of these basic measures will remain for quite a while. So as we have said, we are likely to remain in phase 2 for some time, and then within phase 2 we will continue to monitor the situation, and some of the parameters and the measures within phase 2 can be progressively updated and relaxed if indeed the situation remains stable and under control. What are some of these specific restrictions we are talking about? It could be the number of people who can gather. We now have a rule of 5 people. We could increase it to more people later on. For example, we could also allow for, there are also places where we have allowed places of worship, right? We have allowed people, up to 50 people within a place of worship. We have allowed for weddings and for wakes up to 20 people, solemnizations, 20 people. So some of these parameters could also be increased over time. Again, if we monitor the situation and see that it is stable and under control, and importantly, if we see that there is good compliance with safe distancing measures. So Singaporeans also have a part to play, because if everybody cooperates with the measures, we keep the situation under control, then there is indeed a higher chance that there will be some relaxation around some of these control measures. Likewise with the border measures, right? At some point in time, again, if the situation remains under control within Singapore, and as we see the situation in other countries also stabilizing and under control, we will also review and update our border measures with other countries and allow more travel to resume. So these are all the things that we can expect in the coming months, still within phase 2, before progressively as we reopen more and more, then we will, as we say, at some point get into phase 3, which will be the new normal for us until a vaccine is ready.
I think I should perhaps add to say that as we complete our clearance of the dormitories and migrant workers, we will still need to monitor the situation, because we expect that economic activities will pick up further as migrant workers were now allowed to go back to work. More and more migrant workers were allowed to go back to work. Construction activities, for example, will begin to pick up, and associated activities will also pick up. And therefore, we do need to keep an eye on this sector As Minister Wong mentioned, we do expect to see from time to time cases, COVID-19 cases among the construction industry. We already see some of that today, those who are not staying in the dormitory. So therefore, we do expect the number to remain somewhat. So we need to watch carefully to make sure that there's no big clusters. And we continue to see community cases, although today I mentioned that our unlinked cases arising from ARI symptoms are low, still low, but we need to watch because anytime it can pop up. Many countries and many regions where we have seen have gone through the same process. They have gone through a period where 0 cases throughout the entire region, but after a while, cases pop up again, and now many of them are seeing a second wave. And therefore, we cannot let our guards down. We need to continue to monitor, and we will probably look at how the situation is like several weeks after we have completed our dorm clearance, and then we can make an assessment. How do we progress from there? Maybe by that time, we will then be able to share more with the Singaporean as well as with the media, our roadmap ahead, and to be more specific in what we can do after that and to reach our phase 3.
Thanks, Ministers. Next question is from Sharon C. from the Business Times.
Good evening. I understand that you said the dorms will be cleared by the first week of August. So I was wondering if you would also be able to share how many foreign workers have so far returned to work and how many are still unable to do so. And if not, if you could express this as a percentage of the foreign worker workforce. Thank you.
I gave a figure a few weeks ago and it's outdated. I don't have the latest figure, but as where we are now, I think easily more than 80% of the migrant workers in the dormitories have been cleared, right? And there's only, as I said, possibly 28,000 or more that are just remaining to be cleared, serving their isolation period. And then by 7th of August, we'll administer the final test for them. Some of them may be negative, they will resume work. Some positive, their isolation periods will extend further. So that's the current situation with respect to testing and clearance. Amongst this group, how many are working? It's not 100%. As I've explained, there is a time lag between the time when the workers are cleared and recovered, or cleared and able to work, and the time when work actually resumes. And this happens for several reasons. Number one, the company itself may not have met all the safe management requirements for the work sites, which we require of them, particularly for the contractors. And number two, many of these employers come from a whole range of different, or the employers, even if they are all in construction, they cannot start work if there is a missing link, because you need all the different parts to come together. For example, in a construction project, you very often have multiple contractors, a main contractor and multiple subcontractors. And if there is, if the project is at a particular stage of work and you need workers who are critical with the skill sets that are needed for that particular stage of work, but the subcontractor with the workers is not able to restart, or maybe the workers are not ready, then the entire project is stalled for the time being. Right? So this is the nature of construction. It's not just one company, it's multiple companies working together as part of an ecosystem. And that's why you do see often the workers may be cleared, but they may not all be working immediately. So even now, as we get ready for, as I said, beginning of August, where we expect the vast majority, almost all workers to be cleared by then, I think at that time, some of these issues will be resolved because most of the companies will have their workers cleared. Then what remains is for the companies themselves to be able to fulfill all the safe management practices that are needed for their work sites, for transportation of workers, and also for subsequent housing of workers, to make sure that all these things are in compliance with our new requirements. And that's why the agencies like BCA EDB, where it comes to marine and process, are actively engaging all the employers now to ask them to work in parallel to get ready all of these requirements. Do not wait until middle of August when all the workers are cleared, or even 7th of August, which is our internal timeline or our timeline for clearance, right? By the end of the first week. Start now, right? Begin now, submit all the requirements now so that you can get all of this working in parallel. And then when the workers are ready, you can immediately have work resume as soon as possible.
I realize I may have given an inaccurate response to the question from our colleague from Reuters. I mixed up the use of safe entry and trace together. Safe entry is where we already have some information about a person being at a particular location, and that information we may use as a memory aid to jog the memory of our patients with a view towards facilitating activity mapping and contact tracing. Trace together only senses whether a person is in close contact with others. It doesn't register location data, but we use trace together then to help us to trigger notifications to others about their being in close contact with a confirmed case, and then that also facilitates subsequently quarantine orders being delivered.
Thanks, DMS and Minister. Next question we have is from Jana from Tamil Murasu. Jana, please.
Okay, hi, good evening. So we are seeing cases who have gone to cinemas and crowds at night spots and beaches. Of many of these places, which are the biggest problem spots encountered? And also about the 40% figure of those who went out with symptoms, and including the 1/3 that went to work. How were these figures arrived at, and how were each of these cases dealt with? Or how were these cases dealt with? Thanks.
These are cases that were confirmed cases eventually after they have been confirmed as COVID-19 positive. Then, as part of the contact tracing, we trace back their history before they went to see the doctor, before they were quarantined, before they are isolated, because we want to know who they have been in contact with. And of course, then we will find out when did they go and see the doctor, and when did they start to have symptoms, how long did they take between starting to have symptoms and visiting the doctors. And once they are visited the doctors, usually we will have, now we will have swabbed them if they have ARI symptoms, and straight away we will tell them to stay at home, wait for the results, and if the results confirmed positive, we will pick them up and put them in isolation and provide them with the necessary treatment. But what we are seeing is that some of them, 40% of them, actually spend time going to different places before they go and see a doctor while they develop symptoms. To be fair to some of them, the symptoms may be very mild. To them, they may feel that this is maybe just a cold, maybe just a little bit of a scratching throat, a little bit of a sniffle, and they may think nothing about it, and hopefully it will blow over in a day or two, and some may decide to self-medicate, which we usually do in the past. But what we want to do is to remind Singaporeans that please don't do that. Please go and see a doctor as soon as possible. This is particularly important for COVID-19 because the patient is infectious during the initial days of becoming symptomatic, and they were infectious even before symptomatic. So we want them to go and see the doctor to seek help as soon as they observe some symptoms. Don't try to self-medicate, or don't try to wait for it to be blown over. Particularly during this period of time, don't go out and to mess with places where there are messes, and don't go back to work. And I can understand many of them are very conscientious. They feel bad not to turn up for work, so they would rather go back to work, just wear the discomfort. But I think for purposes of COVID-19, please don't go back to work, and please report sick. Go and see a doctor so that we can follow up quickly to prevent further transmission. This is not only for your own benefit, but also for the benefit of your employer as well as your fellow workers. So I would not want to, in a way, criticize them or penalize them, because we know in the past we always do that. We ourselves do that. But for COVID-19, please help us, cooperate with us, and go and see a doctor, seek help as soon as you have some symptoms. And we also know that there are patients who are asymptomatic, and those cannot be helped. So eventually, when we detected them as positive, and they might have gone to quite a number of places because they are asymptomatic and they do not know that they are sick. So I think, bear with us, we may be very inconvenient to you, but try to go and see a doctor as soon as possible, as soon as you have any symptoms, so that we can reduce the risk of transmission and we can reduce the risk of having a cluster forming. So I think this is a very important part of our contact tracing and detection strategy.
It's not just in the workplace, but also to be mindful that we also have loved ones at home, and some of our loved ones, in fact, may be much more senior in age. They may have other medical problems, and if we have symptoms and we are going to see a doctor early, we're actually doing our bit to protect them as well. So it's important to be mindful that it's not just protecting our employer, our colleagues, it's protecting our loved ones at home as well. The other setting where we would ask Singaporeans to be perhaps more mindful of the possibility of spread is when, if you happen to be working in a sector that requires routine, regular testing, and you come forward, we mentioned about pool testing before, you may have gone for a pool test, and you're notified subsequently that you should come back for another test, perhaps now an individual test to verify your status, and there's always a possibility that that test might turn out positive. So if you are in that setting, even though you're well, you're called to come back for another test, please don't go out and then go around to the shops, the supermarket, after you've had such a test, because it's important for us to check whether indeed you are infected, even though you're well, and keeping isolated even in that setting helps to protect the people around you, particularly your loved ones.
Your first question was, if I can recall the question correctly, correct me if I'm wrong, you asked amongst beaches, cinemas, parks, these are getting crowded, which one is the more problematic area or setting? And my short answer is, it's not which one is more problematic, but any space can pose a problem if individuals who are there do not take the practice safe distancing properly, right? If there is a lapse in behavior, if people gather together, in any of these settings, it can be a beach, it can be a park, it can be an F&B outlet, it can be a cinema, but where individuals do not practice safe distancing, where they do things like, if feeling sick, but still go out and mingle with their friends and family members, then any of these settings can potentially become areas where the virus spreads potentially beyond that one group of people you're with to others around you. And so we just have to continue to stay vigilant. The areas that you mentioned are spaces that we can see crowds, but I would also say some of this can happen even in places that are not so visible, because people are visiting one another in their homes. We may not be able to see them all the time, but if, again, there are people who do not comply with the rules, and you have large groups of people coming to visit one another, beyond 5 people, 20, 30, have a big celebration within your home, then again, may not be visible, may not be on social media, you may not have pictures publicized, but in the end, you are putting yourself and your own friends and family members at risk.
Maybe I can just give a rule of thumb guide. So the transmission basically depends on 3 very important factors. First, the number, the frequency, the number of people that you come into contact with. The more people you are in contact with, the higher the risk of being infected, and higher the risk of you, if you are an infected person, to spread to more people. So the number of contacts that you have. Secondly is the distance. The closer you are to the contact, the closer you are in talking to them, speaking to them, and having interaction with them, the distance makes a difference. The closer you are, the higher the risk of an infection. Third is the duration. The longer you spend in a confined space, the higher the risk of transmission. So if you are able to work on these 3 items, the number of people that you're in contact with, the distance that you keep between you and the next person, safe distancing, and thirdly, the duration. If you are able to work on these three, you will be able to reduce the transmission risk.
Thank you, panelists. We will have the next question from Cassandra Wong from Yahoo News.
Hi, can you hear me? This is related to the previous questions about cinemas. So in the recent days, there have been at least 2 cinemas that have been added to the list of public venues visited by infectious community cases. And this is within days of these venues reopening. So my question would be, will authorities be introducing additional measures for these venues at this moment, especially given the nature of these venues, as well as they have been the origin of clusters overseas, especially in countries like Japan? Thank you.
Thank you very much for the question. There were indeed 2 cases, 2 patients that we've had who, when we traced back, we realized they'd gone to see a show, 2 different cinemas, 2 different movies. And as a result of going to these places, we've had to also do contact tracing within the cinemas and identify those who were seated in proximity to these particular individuals and put them on quarantine as well. So we continue to monitor them. At this stage, we don't have any information to suggest that these 2 individuals got the infection in the cinema, nor do we have any evidence to suggest that those who are in close proximity are going to get infected because they are on quarantine at this stage. So we're keeping a very close eye on the situation. If we find that there is evidence to suggest spread occurring within the cinema, we will be prepared to take further action to safeguard that risk of spread occurring within the cinema setting. But we don't have any information at this point in time that this is actually occurring in Singapore. Nonetheless, I would strongly advise that for those of you who do go out to see a show, please do your bit also to reduce that risk of spread of infection, because you might be asymptomatic, you might be infected. We recommend that you continue to wear your mask throughout the entire show and not to take it off. We know that it's very tempting to buy a drink, get some popcorn, have some food and drink. We haven't stopped you from doing that, but please don't eat and drink excessively throughout the entire show. Please put on that mask again after you've taken your sip, taken a bite, and therefore keep the mask on as long as is possible during the show itself. And that will certainly help to reduce the risk of any theoretical spread occurring within that cinema setting.
Just to make one quick point, we provide a list of all the places that infected persons have been, and we have been updating that list on a daily basis. And we should also, there's a need to understand why that list is provided and to understand how to make use of that list of that particular information. Having all these places that infected people would have visited in the past is to provide an activity map and then to encourage anyone who may have been to that same place at that particular time. And if you see yourself being in that same shopping center, hawker center, cinema in that same time, and you start feeling some symptoms, then you might want to step forward and be a little bit more alert and vigilant about your own condition. That's one purpose. Second, that list of places doesn't mean that the places inherently are riskier or of higher risk. But what we will do is each time there is an infected case in any venue, we do the contact tracing, as Director of Medical Services says, and if there are suspected cases or confirmed cases beyond that one case, we will, as we have highlighted before, cast a wide net around the people who have been there, who are working in that place, who are the employees there, and then we will do active swabbing operations. We go there, we might swab everyone, we might even close the venue. And if indeed we find that these safe distancing measures are not sufficient, we might have to, maybe it's an enforcement issue, maybe it's the restrictions or the measures have to be tightened up. And it may well be that if it so happens, as we monitor these cases, if indeed we find venues that are inherently of higher risk, if we do so, then we may well have to decide to close some of these venues. So that's the basis in which we will operate, and we continue to watch all of these places, whether it's a cinema, whether it's a F&B, whether it's F&B establishments or shopping malls.
Thank you, panelists. We have time for the last 3 questions. Third last question is from Gwyneth from CNA. Gwyneth, please.
Hi, Gwyneth from CNA. Thanks. Can we get an update on what's happening for the opening of the border between Malaysia and Singapore? Are we still on track to do that on 10th August? Are there SOPs already in place? What's going on in terms of like any testing to be done, measures, issuing of visas for the essential travel back and forth? And also, does Singapore have a stance on the possibility of airborne transmission? Will that change any of the safe distancing measures or other measures that we'll be putting in place? Thank you.
On Malaysia, the discussions are on track. We have highlighted before that we have agreed on a reciprocal green lane with Malaysia for business travelers and a periodic commuting arrangement for workers, meaning to say that they spend some time in Singapore, 3 months or so, and then they can go back to see their family members in Malaysia and then come back again, subject to some periods of quarantine when they are back and forth. So these are the arrangements that we have agreed upon, and they will be implemented in due course. The one aspect of the travel arrangements that we are still discussing with Malaysia are for the daily commuters. And as we have highlighted before, we do not want to see that large volume of daily commuters as was the case before COVID-19, simply because on both sides, neither Malaysia nor Singapore will be able to accommodate that large volume of travel on a daily basis in a safe and sustainable manner in a COVID-19 environment. So the discussions around the arrangements for daily commutes are still ongoing.
I should perhaps add that on the border control with Malaysia, we do not think that, I think many Singaporeans are still very keen to take a weekend holiday in Malaysia and vice versa. I don't think that's going to happen anytime soon, because even with the daily commute arrangements, it's going to be quite stringent and quite tight, and they are likely to be meant for very essential service workers and that need to travel to and fro on a daily basis. So I think those who are thinking about holidays, unfortunately, I think we have to put off the idea for quite some time yet, and we are still continuing to work on whether or not we can continue to open the borders to more countries, to more regions. But again, it also depends on the infection situation in those regions and countries, and we will have to work on some bilateral arrangement, understanding each other, and have an arrangement both sides to allow more travel, to facilitate more travels. On the airborne nature of the virus, I asked DMS to elaborate, but generally we are aware of the aerosolization possibility, risk of the virus, and we have been monitoring the reports and research outcome on this topic. Generally, our stance has not shifted. The measures that were put in place are generally adequate. We just have to make sure that all of us comply with the safe distancing measures, wear a mask when you go out, and for the seniors who are more vulnerable or those with chronic diseases, you may need to make sure that you minimize going out, stay at home as much as possible to protect yourself. And if you do go out, please make sure that you wear a mask. If you need be, you can wear a surgical mask to make sure that you get adequate protection from possible infection. So I think for the more vulnerable seniors and those with multiple chronic conditions, we will encourage you to exercise more caution in your daily activities so as to protect yourself. But generally, for the general public, I think the safe distancing measures that we put in place, it is important to observe them and to take them seriously, and that's why we are stepping up our enforcement as well as our surveillance going forward. DMS?
We continue to monitor the evidence coming out concerning airborne transmission. At this point in time, the evidence actually hasn't changed a lot since February. We do know that the majority of cases arises from transmission that may occur through a droplet spread or through fomite contamination of surfaces. airborne transmission or aerosolization can occur in specific settings. In the past, we recognized that aerosolization could occur very easily through certain types of medical procedures occurring in a healthcare setting. We're starting to understand a bit better about the possibility of this occurring in settings where people are in closed, confined areas with very poor ventilation. And I suspect there will be more evidence progressively to help us to understand that risk better. We do have some studies, some research being done to help us to assess whether or not viruses are viable if they were in fact disseminated or spread through these micro droplets. And the evidence remains mixed. There are some studies that suggest there may be some viable viruses, yet others suggest that there isn't enough of a dose that presents a significant risk for spread through this route. So I think the evidence still is a little bit mixed. More evidence continues to emerge, and we will continue to monitor this area closely. And if we assess that the body of evidence requires us to change our policy position, we will certainly do so. However, the existing protective measures that we have recommended and continue to recommend, we believe that these would be appropriate and adequate to protect us in the majority of settings that we find ourselves in.
Thanks, Ministers and DMS. Second last question is from Hamid from Berita. Hamid, please.
Hi, Ministers. I understand that the popular public places such as parks and beaches will be closed temporarily. So first question, can we know when this will take place? Is it with immediate effect? Secondly, is there a list of these places? Thank you.
What's the last part? Is there a risk of? When was it going to close? And the second question is? Oh, I see. List. Okay, got it.
Yes.
Yeah, thank you. We are not closing beaches or parks, just to be very clear. What we are doing is having tighter control measures. So, for example, if you go to East Coast Beach now, you will know that in East Coast Park, there is a stretch which tends to be more crowded than other parts. That stretch is from the hawker center to McDonald's, where Marine Cove is, right? And within that stretch, there are maybe about 3 beaches, right? And that tends to be the more popular stretch along the entire East Coast Park. Not all of it is crowded. So when it comes to that particular segment, we will have control measures, what we call control points, in order to limit the number of people who can access the beaches in this particular stretch. And when the officers assess that the beaches are reaching their capacity limits, then they will stop people from coming in so that it doesn't get too crowded, and they will move people along. And likewise, if the car parks get a bit more crowded, they will start to, close the car parks before it reaches its limits, and then try to move the cars to other parts of the beach or other parts of East Coast Park, which are less crowded. So it's really not about a full closure, but it's about tightening up the access controls so that when we see at any point in time the crowds starting to reach capacity limits, then they will start to stop people from coming in, and then to try and divert traffic to other parts of the park or the beaches or other areas where there are fewer people. So I've just described what we will do along East Coast Park. The similar approach will be taken in other parks as well, where, for example, if we see a particular park getting more crowded, then there will be some access controls to say, look, the park is reaching its capacity limit, and therefore we will not allow people to come in. Please go to another park, go to another green area that you can access, which is less crowded. So these are what we call localized control measures for better crowd management, which we will apply in the parks and beaches.
So some of these measures, I should just add that they may create inconvenience to Singaporeans, so please bear with us. Some of the social distancing ambassadors may ask you to please move along. We hope that you cooperate with us and move along, and sometimes we have to temporarily close the entrance to the park so that there are too many people inside. May ask you to go another park, so please help us, cooperate with us. So these are inconveniences, but I think for the safety of the population as well as your own safety, I think please cooperate with the safe distancing ambassadors, follow their guidance and their instruction, and this way we can all stay safe.
Thank you, panelists. Our final question is from Yi Jun from Shinmin Daily.
Hi, good evening to all. This is Ijin from Shinmin Daily News. According to NEA, dengue infection cases are rising at very fast speed. I would like to find out whether these have any impact on the current management of COVID-19, and is MOH facing any challenges in medical resources when handling both dengue and COVID-19 situation at the same time. And then my second question is, currently we have close to 50,000 COVID cases in total. Then among all these cases, are there any cases that belongs to second infection? Yeah, thank you.
Thank you very much for your question. So answer perhaps the first question on dengue first. We are keeping an eye on the dengue situation, and we collaborate very closely with NEA, who is taking the lead when it comes to vector control, helping us with eradicating mosquito breeding spots in the community. At this time, we have seen an increase of people coming to our clinics, presenting to our emergency departments for fever, and we are carrying out more tests to exclude or diagnose the possibility of dengue infection in them. But in terms of the increased number of cases coming to see doctors, this is still manageable. The majority of cases with dengue do not require inpatient care and can be safely managed in an outpatient setting. And because of this, our hospitals have not been unduly burdened with needing to admit too many patients as a result of dengue. Dengue and COVID also share some very common symptoms. In both settings, patients may present with fever, and it's important, therefore, for doctors to be mindful of the possibility that either diagnosis is present in a patient with fever, and they will do the necessary tests to exclude either or both conditions being present in patients who present. So the increasing cases of dengue lead us to test a bit more, be absolutely sure about what we're dealing with. We have seen increased cases coming to see doctors in both the inpatient and outpatient setting, but in fact, it has not led to a big burden for us at this stage. We continue to keep a close watch on this. You've asked a second question about whether we've seen any cases of confirmed a second infection. I presume you mean in patients who have had COVID-19 infection, who have recovered, and now present again with a second infection of COVID-19 infection. We are, in fact, keeping an eye, looking out for this particular setting, because there's still insufficient evidence for us to be sure whether a person who recovers from COVID-19 has long-lasting immunity. So it is something of particular interest to us, and we are monitoring the situation closely. But to date, we have not picked up cases that we can, in fact, confirm are reinfections. So it's something that we continue to watch out for, look for, but we have not found any such cases.